Not long ago, seeing a doctor almost always meant a waiting room. Today, for millions of people, it means a video call from the kitchen table. Telehealth, getting care remotely, by video, phone, or app, went from a niche curiosity to a mainstream part of medicine almost overnight, supercharged by the pandemic. But now that the emergency has passed, where does virtual care actually fit? What is it genuinely good for, and where does it fall short? Let's look at telehealth honestly, the real promise, and the real limits. Let's define the territory, because telehealth is a broad umbrella. At its core, it simply means receiving healthcare remotely, using technology instead of an in-person visit. The most familiar form is the video visit, talking to a doctor or therapist over a screen. But it also includes messaging your clinic through a patient portal, phone consultations, and follow-ups handled entirely online. Before 2020, telehealth existed but was a tiny slice of care, held back by habit, regulation, and payment rules. Then the pandemic hit, in-person visits became risky or impossible, and virtual care went from the exception to the default almost overnight, out of sheer necessity. And here's the interesting part, unlike some pandemic-era habits that faded, a large amount of telehealth has stuck around, because both patients and doctors discovered it genuinely works well for a lot of situations. So where does telehealth genuinely excel? The sweet spot is any care that relies mainly on conversation rather than a physical exam. Mental health is the standout, therapy and psychiatry translate beautifully to video, and virtual visits have massively expanded access to counseling for people who'd never otherwise get it. Routine follow-ups are another perfect fit, checking in on a medication, reviewing lab results, or managing a stable chronic condition like well-controlled blood pressure. Dedicated platforms like Teladoc built entire businesses on this kind of on-demand virtual care. But the deepest benefit is access. Telehealth is transformative for people in rural areas far from specialists, for those with disabilities or mobility problems, for busy parents, and for anyone who simply can't afford to take half a day off work to sit in a waiting room. For all of them, care that used to be out of reach is suddenly a click away. That's a genuine leap forward in equity and convenience. But let's be clear-eyed about the limits, because telehealth is not a cure-all. The most obvious constraint is physical. A doctor on a screen cannot listen to your heart and lungs, feel your abdomen, examine a suspicious mole up close, or take your blood pressure. So much of medicine still depends on the physical exam and on tests that require you to be there in person. That means plenty of situations, anything potentially serious, anything needing hands-on assessment or a procedure, genuinely require an in-person visit, and a good telehealth service should recognize that and send you in. There are other real concerns too. Rushed, low-quality virtual visits can miss important diagnoses. Some on-demand services have been criticized for overprescribing, handing out antibiotics or other medications too readily to keep customers happy. And something is lost when care becomes purely transactional, without the continuity and trust of a doctor who really knows you. Convenience has a cost if it replaces depth. So how should we think about telehealth's place? The healthiest framing is that virtual care is a powerful complement to in-person medicine, not a replacement for it. Used well, it handles the many situations it's genuinely good at, the mental health visits, the follow-ups, the access for people who've been left out, while a good system knows exactly when to say, you need to come in and be seen. That's the future almost everyone in healthcare now expects, hybrid care. Not a choice between virtual or physical, but a smart blend, the right kind of visit for the right kind of problem. A quick video check-in when that's all you need, and an in-person appointment when the situation demands hands, tools, and tests. Telehealth permanently expanded what's possible in medicine, especially for access and convenience. The task now is to use it wisely, leaning on its strengths without pretending it can do things a screen simply can't. This is educational, not medical advice.